Assalamu alaikum. My name is Hafiza Noreen and my roll number is BP1650074 and my group number is 35. My group topic is dosing of drug in renal failure. So first, dosing of drug in renal failure. Renal disease alter the effect of many drugs, particularly when active drug moieties are renally cleared. Drug doses should usually be reduced in renal disease in proportion to the predicted reduction in clearance of the active drug moiety. Patient factors to consider in adjusting drug doses include the degree of renal impairment and patient size. Drug factor to consider in adjusting doses include also the fraction of the drug excreted unchanged in urine and the drug's therapeutic index. Now, my subtopic is narcotic analgesic. So first we have to know what is narcotic analgesic. So narcotic analgesics are a class of medicine that are used to provide relief from moderate to severe acute or chronic pain. They may also be called opiates, opioid analgesics, or narcotics. Analgesics is another name for a medicine that relieves pain. Opioids are used to treat acute pain related to surgery and other medical procedure, as well as for persistent, that is chronic, and breakthrough pain that is moderate to severe. Persistent pain is usually treated with long-acting opioids that are released into the body slowly and control pain for long period of time. When opioids analgesic are used for acute pain, clinicians should prescribe the lowest effective dose of immediate release opioid and should prescribe no greater quantity than needed. 3 days or less will often be sufficient. More than 7 days will rarely be needed. Common side effects related to narcotic analgesics are constipation, nausea, vomiting, mood swings. These are the common side effects related to narcotic analgesic. Contraindication. What are the contraindications related to narcotic analgesic? Opioid with serotonergic activity such as tramadol, oxycodone, fentanyl, methadone, buprenorphine have the potential to cause serotonin syndrome when used with other agents with serotonergic activity. So therefore, co-administration with other serotonergic active medication should be done cautiously or avoid entirely. Otherwise, it causes a serious disorder that is serotonin syndrome, in which the activity of serotonin or production of serotonin is increased. Now, my case study is a 67 years old woman presented with painful osteoarthritis in both knees. She was previously treated with NSAIDs but experienced burning epigastric pain not associated with gastrointestinal bleeding as an adverse event associated with those medications. So firstly, my subjective is a woman of age 67 years old. She has a chief complaint of osteoarthritis with a history of pain and GI problem. The current medication used is NSAID. Objective is, as per previous diagnostic and documented data, she had episode of GI bleeding. My assessment is, since she has a GI problem, Therefore, she need to shift from NSAID first because NSAIDs are medication that cause GI problems. So my plan is that for pain management, firstly, we have to give sustained release opioid analgesic. Dose is 30 milligram twice daily, Q12 hours, with short acting morphine 15 milligram prescribed every 4 hours. That's about my presentation. Thank you so much for watching my presentation. Allah Hafiz.